The majority of people, though not all, that have a job have worked at work mostly. Whether you're a teacher going to school, whether you're a nurse or a doctor going to the hospital, whether you are an office worker going to the office, your place of work is a physical workplace. You may have a desk, you may have an office, you might just hot desk, but you go to a place called work, and at that place you're physically present. You may have your managers there, you may have people that work with you and colleagues, but when you are there, the expectation is that you are available for certain periods of time, that you probably have a work schedule, that you're accountable, that you're available for meetings, for example. And working at work is very much also about the quality of how and where you work. And so you're not going to be very happy working at work if your desk isn't comfortable, if it's too noisy for you. And so a lot of work's gone in over the years to creating workplaces that maximise employee well-being at work. Some places physically clock you in and clock you out. And factories, as people will know, that can get, I would say, almost ridiculous, where you're timed literally to the minutes of going to the bathroom. But working at work as the workplace has been our default way of working. And coronavirus, of course, has thrown that up in the air, because we are simply not able to work in a lot of our workplaces. And some people, certainly at the beginning, were asked not to go unless it was absolutely essential. And people who did often go to work were key workers. And there were risks associated with that, and there was a certain courage that was applauded for people that were going to work on our behalf. For example, people in the health services, people in supermarkets, delivery companies, people went to work to do that work. As we emerge into a different phase of coronavirus, a lot of people are finding out they may not be able to go back to work. For example, my part-time role in a university means that we've been told we probably can't go back, and there'll be a limited number of hours we can work at work. So the issue now, if you are still having a workplace for people to go back to, of course, is going to be all about health and safety, all about people feeling safe to go back to work, to commit to the work that they're doing, and also to now start to manage how long people can spend at work, and also how much time they need to balance that with time at home. So if you haven't done, there's a lot of resource, of course, available out there now, and people sharing their stories of that process of either working at work through the pandemic, or now starting to imagine, design and actually implement going back to working at work. In most cases now, there's a conversation going on, at least around, do we need to go back to a place where working at work happens at all in terms of a physical workplace? And the silence that greets you sometimes if you go into cities like London around the financial sector is that some people running organisations have seen either a cost-saving opportunity or deem it to still be safe and more preferable to work from home. But questions to ask yourself, either as a leader or as an employee, are how do you feel about going back to work? Do you feel safe? How can you make it safe for people to be at work? And how do you make sure we don't lose all of that informality where people might just have coffee together, wander over to someone's desk, have an informal meeting, meet in the corridor? If we've got, stuck down with hard-wearing tape on the floor, arrows, and signs saying, please don't stop here, please move on, and so on. Working at work, if it was problematic before in some cases, is going to be a challenge and problematic for a lot of people. And it needs to become a priority, and you can't put your head in the sand by just telling everyone to go back to work and doing it in a lazy way.